Hey there, overcomers! Welcome back to our channel, where we dive deep into fascinating medical topics that impact our lives every day. Today, we're exploring a condition that is as intriguing as it is important, the silent killer, acromegaly. Stay with us until the end, when we will share one interesting fact that can prove helpful when it comes onto your hormones. Have you ever wondered what happens when the body just doesn't know when to stop growing? Well, that's what we're talking about today. Acromegaly is a rare condition that causes abnormal growth of the hands, feet, and even the facial features. But it is not just about looking different. There's a lot more going on beneath the surface. Acromegaly is primarily caused by an overproduction of growth hormone from the pituitary gland, a tiny but powerful gland located at the base of your brain. This can lead to a range of symptoms and complications, which we're going to uncover together. From subtle changes in appearance to more serious health issues, acromegaly can affect individuals differently. Early detection is key, but because it develops slowly, it often goes unnoticed for years. Send us your comments and share your stories with us so we can support each other. In today's video, we'll discuss the causes, symptoms, and treatments available for acromegaly. If the pituitary gland produces too much growth hormone, you develop the condition called acromegaly. With this excess growth hormone, your bones increase in size. The term gigantism is when too much growth hormone leads to increased height in childhood. However, acromegaly is the opposite. It increases the bone size in the face, hands, and feet in adulthood. Acromegaly is a rare condition that slowly changes the physical appearance over a period of time. These changes are most likely found after many years of damage. Family members and friends are less likely to spot these changes early. These changes are sometimes found when comparing old and new photos of the affected person. The most common signs of acromegaly is the progressive increase of your shoe size and you are unable to wear your rings as you used to do. With acromegaly, your nose may become enlarged, the space between your teeth become wider, your lips thicken, the shape of your face may change, and the lower jaw and brow bone protrudes. The symptoms and signs of acromegaly may vary from person to person. Here are 13 common signs and symptoms of acromegaly. Number one, husky voice, deepened, which is caused by enlarged vocal cords and sinuses. Number two, enlarged hands and feet. Number three, coarse, oily, thickened skin. Number four, excessive sweating and body odor. Enlarged facial features, which includes the lips, the nose, tongue, and jawbone, is number five. Number six, small outgrowths of skin tissue or skin tags. Number seven, erectile dysfunction in men. Number eight, pain and limited joint mobility. Number nine, headaches due severe and persistent. Number 10, severe snoring due to obstruction of the upper airway. Number 11, an interest in sex is lost. Number 12, vision problems. And number 13, irregular menstrual cycles. When growth hormone released by the pituitary gland is in the bloodstream, it triggers your liver to produce a hormone called insulin-like growth factor 1, IGF-1. This is referred to as insulin-like growth factor 1 or IGF-1. This causes your bones and other tissues to grow. Too much growth hormone leads to too much IGF-1, which can cause acromegaly signs, symptoms, and many serious accompanying complications. Treatment options typically include surgery or radiation to remove or reduce the size of a tumor that is causing your symptoms, and medication to help normalize your hormone levels. Treatment options typically include surgery or radiation to remove or reduce the size of the tumor that is causing your symptoms, and medication to help normalize your hormone levels. Doctors can remove most pituitary tumors using a method called transpernadal surgery. During this procedure, your surgeon works through your nose to remove the tumor from your pituitary gland. Consider subscribing to our channel so you won't miss out on any upcoming topics we have lined up for you. These are some foods to avoid if you are diagnosed with acromegaly. It is important to limit your intake of foods containing saturated fats such as fried foods, pizzas, commercial burgers, cakes, potato chips, and other packaged snacks foods, added salt, added sugars, and alcohol. Can acromegaly be reversed? Many of the changes related to acromegaly can be reversed once the growth hormone and IGF levels are normalized. However, the changes in the bone structure do not reverse. Which complication of acromegaly can be life-threatening? These are excessive growth hormone causes bones and organs to grow too large. Acromegaly gradually worsens over time. Without treatment, acromegaly can lead to complications including life-threatening heart and blood vessel disease. Send us a comment and let us know if you have any topic of interest and we will get the facts for you. These are the hormones that your pituitary gland makes. Growth hormone, which regulates your growth. Number two, thyroid stimulating hormone TSH, which tells the thyroid gland to make hormones. Prolactin. Number three, which controls breast milk production. Number four, adrenocorticotropic hormone ACTH, which tells the adrenal glands to make hormone. Follicle stimulating hormone FSH, which is involved in the reproductive system, and lutein sting hormone, which is also involved in the reproductive system. Your pituitary gland also stores and releases oxytocin, which is involved in childbirth and breastfeeding, vasopressin, which helps control the amount of salt and water in your body. These hormones affect your metabolism, your blood pressure, and other vital body functions. Your pituitary gland is in control by your hypothalamus. The hypothalamus is found in your brain above the pituitary gland, and it tells your pituitary gland to make pituitary hormone. Don't forget to share this content. You could be helping someone to detect the condition before it's too late. Did you know? I bet you didn't know. How would you know? Too much growth hormone in adults can cause a tumor. This is called a pituitary tumor. A microadenoma is any tumor that is below the size of 1 centimeter, and a macroadenoma for tumors over 1 centimeter. Most acromegaly diagnoses are caused by non-cancerous or benign tumors of the pituitary gland. This type of tumor produces excessive growth hormone, which causes the signs and symptoms of acromegaly. Some of the symptoms of acromegaly, such as impaired vision and headaches, are due to the tumor pressing on the nearby brain tissues. However, in rare cases, some people with acromegaly develop the tumors in other parts of their bodies. These are the pancreas and the lungs, which causes disorders. In addition, these tumors secrete growth hormone in other cases. The tumors produce a hormone called growth hormone releasing hormone, that's GHRH, which signals the pituitary gland to make more growth hormone. What are the risk factors? There is a rare genetic condition called multiple endocrine neoplasia type 1, MEN1. Persons with this condition are at risk of developing acromegaly. In MEN1, the endocrine glands, usually the parathyroid glands, pancreas, and pituitary gland, grow tumors and release extra hormones. These hormones may trigger acromegaly. What are the complications and risk factors? So, with acromegaly, you can develop type 2 diabetes, cardiomyopathy, which is the enlargement of the heart, osteoarthritis, hypertension or high blood pressure, increased risk of cancerous tumors, vision changes or vision loss, spinal cord compression or fractures, goiter, which is the enlargement of the thyroid gland, polyps, which are precancerous growths on the lining of your colon, sleep apnea, which is the breathing repeatedly stops when it starts during your sleep, and carpal tunnel syndrome. Yes. Early detection of acromegaly can prevent these complications from developing or becoming worse. Untreated acromegaly and its complications can lead to premature death. If you find our content helpful, don't forget to hit that subscribe button, give us a thumbs up, and click the bell icon to stay updated with our latest videos. Let's continue to uncover the facts that matter. Check out our other videos on rare medical conditions and how they impact lives. Click on any of the videos to keep learning and stay informed. See you in next time. And remember, don't just survive, overcome.